will be gentle with myself, I will love myself. I am a child of the universe, being born each moment. I will be gentle with myself, I will love myself. I am a child of the universe, being born each moment. I will be gentle with myself, I will love myself. I am a child of the universe, being born each moment.
Pleased to introduce our speaker this morning, Dr. Stephen McDonough. I have heard Dr. McDonough speak. I've read his letters, I've read his testimony for many years as he has provided information on health issues in North Dakota. He has served as a physician for over 40 years, including 15 years with the North Dakota Department of Health. During the COVID pandemic, he has been a strong public voice for best practices and good public policies. I'm very pleased to introduce to you and hear Dr. Stephen McDonough.
Good morning. So my name is Steve McDonough. I'm an old pediatrician. I've been in the Bismarck area since 1985 and in North Dakota since 1980, over half my about to be 71 years of life. But I'm not a North Dakota native. So anyway, I'm here to talk about why speak up. And I want to thank you for the invitation today. Thank you for the Conrad family for supporting your hybrid model. And it's exciting that you are able to get together today and are taking the appropriate precautions. So I've been asked to talk about a few things. One is what are key parts to good public policy, and why within this is explain why vaccines are so important. An overview of what organizations should be doing during the COVID pandemic, and then how is our state doing, and why was it important for me, and encourage others to speak up about this. So there's different ways of looking at what good public policy are. The Pew Charitable Trust has 5 different components, and I'll go through these quickly. But one, when you're getting involved in addressing an issue, you should do, first of all, a thorough review of what the most effective public programs are to address the issue you're looking at. Then you put together a budget based on how you want to spend your dollars, and with a high priority to put those resources in what's going to be most effective, because you've done that research on effectiveness. And then you implement your programs and you evaluate how they're doing, and you monitor them, collecting data on see which programs are getting the best results. And then if you're doing something experimental that hasn't been tried before, you really put a lot of intensive evaluation in them. So it's a very science-based approach to good public policy during our whatever issue you want to address. And now it gets to the point of how did we do with our public policy in our state and our country with COVID? And the answer is not good, okay? Needless to say, North Dakota state leaders failed to implement good public policy regarding COVID. Basically what happened in our state, an untested and unproven political approach, which is called the light touch of government and individual responsibility, was taken with disastrous results, over 2,000 dead and counting, and among the worst mask wearing and immunization rates in the United States. North Dakota state leaders had absolutely no idea what they were doing, and they weren't even evaluating mask use during 2020, when that was the most important thing for us to be doing. Our approach in our state lacked honesty. If you recall the color-coded state map that came out on a periodic basis, did not actually represent true risk of COVID. It was a terribly flawed instrument. So North Dakota were not told the truth about how bad the situation was in our state. North Dakota leaders lacked courage, and they didn't role model mask wearing during the news conferences, and they didn't call for mask mandates when that was what we needed most in 2020. And they lacked leadership by placing the burden on local communities and then blaming them when things didn't go well. So I look at this as one of the worst examples of leadership I've ever seen in my lifetime, and basically describe what went on in our state as total cluelessness with our state executive and legislative leaders. Vaccines are the most effective public health intervention ever invented. Absolutely nothing comes close to how powerful vaccines are in addressing health issues. And I've said for decades that unless you have a vaccine for something, that problem's not going to go away. Smallpox has been eliminated from the world, and polio is only found in 3 countries, and potentially we can eliminate polio in the world. Those are Nigeria, Afghanistan, and Pakistan, where you have a lot of social disruption where polio has not been eliminated, but eventually, hopefully, we'll get there. Many other vaccine-preventable diseases are now very uncommon. COVID immunizations with boosters provide excellent protection, are safe, and free. There are 3 COVID vaccines available in the United States: Pfizer, which is 2 shots 3 weeks apart, followed by a booster 5 months later now. It was 6 months, now 5 months. Unless you're immunosuppressed, when the booster should be given 28 days after that second dose. Moderna, which is the one that I've had, and I don't recommend Moderna over Pfizer or anything like that. They're both excellent vaccines. I'm just sharing that I did have Moderna. That's 2 shots 4 weeks apart with a booster 6 months later. Unless you're immunosuppressed, like you have cancer or chemotherapy, you have a genetic condition which causes your immune system not to be robust, then you should get a booster 1 month later after the second dose. And then the Johnson & Johnson vaccine, which is given as 1 shot with a recommended booster 2 months later with either the Pfizer or Moderna vaccine, because the Johnson & Johnson is not the preferred one according to the Centers for Disease Control now, because there's a very rare risk of blood clots that can happen after the Johnson & Johnson vaccine. It's still a very decent vaccine, and if you had Johnson & Johnson, you consider, and you haven't been boosted yet, you consider get a booster for that, or talk to your provider about getting Moderna or Pfizer. Pfizer is the only COVID vaccine authorized for children 5 to 17, with a booster recommended for children, teenagers, 12 to 17 now. Unless you're immunocompromised, then you can get the booster 1 month after your first 2 Pfizer shots. So, I want to talk a little bit about what COVID was like in our state. And most recently, during the Delta variant pandemic, which was August through December of this year, 482 North Dakotans died during those 5 months. And if a reasonable estimate that 80% of those were vaccine preventable, that would mean that 385 of those deaths over 5 months were totally unnecessary, which is about 2.5 deaths per day in our state. And this undoubtedly represents the greatest failure of avoidable death in our state's history over a 5-month period. So in 2020, what we needed to do was to wear masks and socially distance because we didn't have a vaccine during 2020. In 2021, the vaccines became available, and certainly during the Delta phase from this last 5-6 months we've been in, most of those hospitalizations and deaths could have been prevented. So COVID was terrible in our state. Our state has a higher death rate than the national average. And we have 16 counties in our state that have higher cumulative death rates than New York City since the beginning of the pandemic. those 16 counties in North Dakota are mainly rural, and they represent 30% of the counties in our state. So in North Dakota, which historically has had good public health, almost 1/3 of our counties, your risk of dying of COVID in those counties was greater than living in New York City. And I think we can all recall what New York City was like at the beginning of the pandemic. I recently went to Elgin, Glen Ullin, and Richardson in December to visit physician clinics, advanced provider clinics, to talk about COVID immunizations. I explained why COVID was so deadly in our rural areas and tried to break through the COVID denial in rural North Dakota in those areas. And this was new information to them. It's not been explained by our North Dakota state leaders why COVID was so terrible in our rural state that we live in. There was a expectation when COVID first started that North Dakota would be spared because we are the fourth most rural or fourth most rural state in the country as far as population density, okay? But that represents a fundamental misunderstanding about rural North Dakota and the nature of state, because you can be physically distanced, but you're not socially distant. Rural people are very social, perhaps because they are physically distanced. Their ranches may be 5 or 7 miles apart. They love their schools, they love their churches, they love their bars, and those are all small buildings. And when you're not wearing masks, COVID spreads. And the other thing about rural North Dakota is there are a lot of vulnerable people in nursing homes in our rural areas. We have the highest percentage of people over age 85 in a nursing home in the country. So what happened in our state was that people were not wearing masks, they had COVID denial, and they had all these small little places for COVID to spread and got into the nursing homes, and it was just absolutely terrible. But anyway, that's new information to a lot of folks to explain why we had the highest death rate in the United States for 2 months in 2020. So COVID denial is rampant everywhere. The highly infectious Omicron variant is exploding, and people are well advised to wear a mask, socially distance, and get immunized, including the booster shot. So what should organizations be doing? Well, you're a role model right here, okay? You've been socially distanced for most of the pandemic. You're requiring masks and immunizations for folks who come, and you're setting a good example. So you provide education, you set a good example, and you're implementing good policy for your members here. So mask wearing, social distancing, and COVID shots with a booster is the way to go, and if you've not been boosted and you're eligible for the booster, I highly recommend it. Provide assistance to vulnerable members. If there's members of your congregation that are having a hard time getting vaccinated, try to help them out the best you can. And requiring masks and social distancing in churches is what they should be doing as well. Encourage the non-immunized and the ill to stay at home like you have done. So how is our state doing? We're not doing well. We're in the midst of the fourth wave of COVID with the Omicron variant exploding. If you watch the numbers this week, but they've over 1,000 cases a day been happening. Our state still has one of the highest rates of vaccine resistance in the United States. And there are many powerful right-wing extremist state and local leaders who fight progress every step of the way. It's been very difficult to get good policy in our state. So why speak up? I'll talk a little bit about my own experience here. So 2020, I was at the end of my career. I'd worked for 40 years in the state. I was working in a small independent clinic in North Bismarck with just a couple of other doctors. I did not belong to any medical organizations, and basically was off there by myself. I did have, however, some experience. I spent 15 years at the North Dakota Department of Health, worked with Dr. Wentz, the state health officer, a wonderful man. And for the first part of my tenure there was working under Governor George Sinner, who was a wonderful governor. And we did a lot of good things. And I knew what good public health was. I knew we were not doing that in our state. So what I could do in my own clinic that I worked at, I shaved my beard in March of 2020, early March, and started wearing an N95 mask at work and going out in the public and trying to set a good example. But that was it. I was commenting to our co-workers and family members. I was just really distraught about what was the public health that was being taken. But it sounded like things were getting better up until the end of June of 2020. And then something happened around the 4th of July in the Bismarck, Mandan area, that this community right here became the epicenter of a terrible outbreak in the northern plains that would spread to the rural areas with devastating results. It began here in Bismarck, Mandan during the 4th of July with young people in their 20s and 30s enjoying themselves, not wearing masks. And that should have sent off alarm bells like crazy, okay? Respiratory viruses like COVID, influenza, they don't surge during the summer. What happened in Bismarck, Mandan area in July and August of 2020, the cases started to soar, and that was a huge alarm bell that should be going off. We were heading for an impending disaster, and there was very little being done about it. So I was getting more and more concerned, and finally, end of July, a reporter from K-Fire called me, and I'd not talked to her in many, many years, and she asked me out of the blue to participate in a Facebook Live interview session with the Superintendent of Public Instruction and a couple of parents. I said, well, yeah, I can do that, but I can tell you, I'm going to be telling you stuff you're not going to be hearing from our state leaders, okay? And she said, well, that's why I contacted you. And so I did it, and I asked the state leaders to role model to wear masks anytime in the public, and that was totally ignored. And I recommended starting a hybrid model and then see what happens, smaller class sizes and things like that. So I decided, a lot of people, a few days later, that a lot of people probably didn't see that, so I decided to write my first letter to the editor of the Bismarck Tribune, and they published it with those recommendations. And then I thought, okay, I'm done. I'm at the end of my career. No one wants my opinion anyway, and they did ask, and I recommended starting a hybrid model and wearing masks, role modeling, and so I said, okay, I'm done. I did my part, I'm done. And then I'd go back and forth. The cases in August kept increasing. I remember one, I think weekend day or something, that there was 180 cases reported, which would be, like great now. And I said, okay, I finally had it. Enough is enough. So I composed a letter to the editor with 12 recommendations for good public policy, and the Bismarck Tribune published that August 12th. And then I said, okay, I'm going to send to the Fargo Forum. I didn't subscribe to the Fargo Forum. I didn't know any of the reporters there. And I'll just send it there so see what the people in the eastern part of the valley think, in the east part of the state. And then hardly anything happened. There was like 12 recommendations, mask mandate on or before September 1, wear your mask in public, government leaders, a massive public education campaign on mask wearing is what I was calling for, starting schools in hybrid model. There were 12 recommendations there, and I waited to see. And I got a contact from the pediatricians in the state saying, we'd like you to start mentoring our young pediatricians. They're kind of interested in public policy. So I agreed to do that, and we did some Zoom interviews. And then Jim Shaw, a couple weeks later, had a column about quoting my letter. But I didn't even know he'd written it because I wasn't getting information from the Fargo Forum. So I thought it was a total failure, basically, total failure. There were no other medical organizations that endorsed it. The Medical Association, the dean, the chief health strategist. No one said these were good ideas. So I thought it was basically a total failure, okay? So I'd go back and say, I'm not going to do this anymore. I mean, no one's interested in this. I'm maybe an alarmist, whatever. So I'd go back and forth, and the cases kept going up, and then I'd get ticked off. And then, so I did at the end of August, I did an interview on or TV, and then calculated the lives could be saved with a mask mandate in early September. That was totally ignored. And then I was getting irritated, so I wrote a really caustic letter to the editor in September 2020, basically saying this is the worst public health failure in the history of our state, and you can't just focus on testing and contact tracing. Now, you're only chasing the virus if you do that. It's getting further and further away ahead of you. You need to do masking and social distancing. And then finally in October, the governor was asked at a news conference about how we're doing for mask wearing, and he had no idea. So then I had a scorcher letter. Because I mentioned in good public policy, you evaluate what you're doing, particularly if you never tested it, you've done something that's never been done before, and you should be evaluating it. They had no idea that we were like the worst in the country for mask wearing. So anyway, then finally, the pediatricians that I've been talking to, they got together, they put their letter with 65 physicians signing it, sent it off. 2 days later, Fargo Forum called for mask mandates statewide. They were released in Bismarck. 2 days later, the Bismarck Tribune did. Within a week from my letter on October 12th, Fargo City went mask mandate, same day Minot did, and within 2-3 weeks, half the state was covered with local mask mandates. Okay, the dam broke. I had no idea that that was coming. I thought I was just talking to the wall. And I ended up testifying at the, I don't know if you guys watched, gals watched the October 27th Bismarck Contentious City Commission meeting, went on for 5 hours there. So anyway, by the time that North Dakota did their mask mandate November 13th, the pandemic was already peaking due to the other community mask mandates. And 2 months later, 2 months after having a statewide mask mandate, we had the third lowest case rate in the United States after having the highest for like 3 months, okay? Unfortunately, 500 of our citizens died during the month of November, when we were in our third month of the greatest outbreak. So 2021, after a promising start, we fell behind the national pace for immunizations. And this was due to vaccine misinformation peddled on Fox News and right-wing radio, where many North Dakotans get their misinformation. And despite advanced warnings of vaccine resistance on surveys, our state did not respond with incentives, and the Delta wave proved very deadly in our poorly vaccinated western counties, in particularly the Bismarck Mandan area. So why did I do this? Why did I do all this stuff, okay? I wrote a book in 1989 on the history of public health. It's called The Golden Ounce. It was not a bestseller. You can maybe find it in libraries. But I reviewed 100 years of public health. That was during our centennial year. And I learned from the public health leaders in the past that they did the right thing, fought the good fight, and always were looking after the most vulnerable. And we were not doing that in our state, okay? Our state leadership in the pandemic was terrible. It was not the State Medical Association, the chief health strategist, corporate medicine, by and large, Trinity and Minot is an exception to that, did not confront what poor public policy was going on. And it was addressed by the state's pediatricians, the state's newspapers, and community leaders throughout the state who enacted these mask mandates, and the few school boards that did universal masking during 2021. So for me, trying to do the right thing was over 24 letters to the editor have been published in the Fargo Forum, Grand Forks Herald, and the Bismarck Tribune. Done multiple appearances on KFGO radio, and I'm one of a dozen or so physicians called Vax Champs to go out to these clinics to advise doctors and advanced providers how to encourage their vaccine-resistant patients to get a COVID shot. So that's doing the right thing. Fighting the good fight was testifying at the Bismarck City Commission, the North Dakota Legislature, and the Fargo School Board on there in 2021. And this was all done to help our citizens, even those who disagree with the policy I'm recommending. And it was especially done to help the most vulnerable, those in nursing homes with immunosuppression and other conditions to make them more susceptible to COVID. So people can make a difference. Individual people can make a difference. All these community leaders who spoke up and enacted their mask mandates, the physicians who testified and other people who testified at the city councils to get the mandates, they were fighting the good fight, okay? It's easy to get discouraged. I've been in the state for 40 years and went when we were more of a purplish state. Now we're solid red. And it's been very difficult. There have been many more failures than successes, but keep trying. So this is where you and others can come in. You can write your own letters to the editor or call into talk radio or email policymakers about how your opinions are on issues. I encourage you to do that. The true heroes during the pandemic are the National Guard members who helped with the testing and immunizations, the ER, hospital, and ICU staff that took care of all the patients with COVID, those who are giving the monoclonal antibody infusions, and the public health workers, many of whom were harassed during the pandemic as they just tried to do their jobs. So there'll come a time when this pandemic's behind us, and historians can analyze how our state did and who stood up and spoke truth to power, who provided counsel to community members, which community members showed courage, and which didn't, who didn't, and who voiced their opinions in letters to the editor or emailing decision makers. Churches can look back, as you guys can, with pride, doing the right thing for protecting your members. And this has been a big challenge. It's something I never wanted to see, the worst pandemic in 102 years, and our state was clobbered. But for my part, I did what I could as long as I could, and wish you nothing but the best in your lives ahead. And thank you so much for the invitation to be here today.
We are living neath the great big dipper. We are washed by the very same rain. We are swimming in a stream together, some in power and some in pain. We can worship this ground we walk on, cherishing the beings that we live beside. Loving spirits will live forever. We're all swimming to the other side. I am alone and I am searching, hungering for answers in my time. I am balanced at the brink of wisdom. I'm impatient to receive a sign. I move forward with my senses open. Imperfection, it will be my cry. In humility, I will listen. We're all swimming to the other side. On this journey through thoughts and feelings, finding intuition, my head, my heart, I am gathering the tools together. I'm preparing to do my part. All of those who have come before me, band together and be my guide. Loving lessons that I will follow. We're all swimming to the other side. When we get there, we'll discover all of the gifts we've been given to share. Have been with us since life's beginning, and we never noticed they were there. We can balance on the brink of wisdom, never